Okay, now it's recording.
Okay.
Okay. All right, Kelly, my name is Emily. I'm going to be the nurse doing your assessment today. So I'm just going to go ahead and start by washing my hands again. This is take 2, part 2 of the movie. Okay. So I'm assessing the general appearance of the patient, and right now I'm going to start with the neck. So I'm looking at the neck, inspecting, making sure the trachea is midline, and just comparing around both sides. And then I'm going to go ahead and palpate the neck and the trachea here. And I'm going to check the lymph nodes. So I'm going to do pre-auricular, post-auricular, and then also the occipital in the back. Then on both sides of the neck, I'm going to check the anterior cervical, the posterior cervical, the deep cervical chain, and then if you can shrug up your shoulders a little bit, I'm going to check the supraclavicular lymph nodes. Okay, and you can relax. And you're just checking for any enlarged lymph nodes or any tenderness there. Okay. So then moving along, I'm going to assess the upper extremities. So I'm assessing the patient and their posture and their build. And I'm just going to go ahead and feel the shoulders here. Okay. And then I'm going to go ahead and move to the back. I'm going to inspect the arms and the skin, and I'm going to assess in the back here too. So just kind of like how we did in the previous video. I'm inspecting the skin of the patient for any lesions, any discolorations or masses. And then I'm palpating for temperature, skin turgor on both sides, and then the capillary refill. Okay. Okay, so back of the shoulders here. And that feels fine. You're checking for any tenderness, any abnormalities, or making sure that this is symmetrical. And then moving to the front, I'm just going to check your range of motion here. So I'm going to have you bring your arms forward and then backwards. Perfect. And I'm going to have you adduct, bring them in, and abduct, push them out. Okay? Then I'm going to have you put your hands behind your back like this. Very good. And then behind your head. Very good. Okay, then I'm also going to check for some muscle strength. So starting with the hands, I want you to spread your fingers out and don't let me close them. Okay, very good. Then I also want you to close them and don't let me open them. Okay, very good. Then I'm going to have you just range of motion here, wiggle your wrists, and that is intact. She's able to move them, so she has good range of motion. Then I want you to push down on my hands and pull up. Very good. So here we're checking the flexion and extension. And then also, I'm going to do this with the arms. So I want you to push out. Very good. And then push in. Very good. Perfect. Okay. Good work. Then I'm going to go ahead and assess the patient's pulses, starting with the radial. So right here by the wrist. And then also brachial, inside the elbow. And then also inside the elbow, you're checking the epitrochlear nodes. So you're checking for any enlarged lymph nodes there. Okay, and then we're going to go ahead and do the same for the other side. So checking the radial pulse, and then the brachial pulse inside the elbow, and then the epitrochlear nodes also. Okay, and then we're good there. So then moving on, I'm going to start with the lungs. So as I'm doing this assessment, I'm inspecting the patient's respiratory effort. You're going to see if they're in respiratory distress at this time or how their breathing is. And Kelly's breathing looks great, so we're going to go ahead and start with the respiratory exam in the back. So I might just have you kind of turn this way. There we go. Perfect, so that we can see a little bit better. So then always your inspection is first, and then we're going to go ahead and palpate. And we're going to palpate on both sides. And you're palpating for any masses or any lumps or cysts, anything there, or any tenderness. So if at any time you feel like there's a very tender area, please let me know. Okay, and then next we're going to go ahead and percuss. So with the middle finger, I'm going to tap the other middle finger. Okay, and then next I'm going to auscultate with the stethoscope. So just have you take a few deep breaths here for me, and we're going to hear above the scapula here, we're going to hear bronchovesicular sounds, deep breath in and out, and deep breath in and out. Okay, very good. Then I'm going to check vesicular sounds here, and we're going side to side, comparing both sides. Okay, one more here. Okay, and then I'm also going to do this on the anterior side as well. So, yep, there we go, perfect. So, like again, I had said we're going to inspect, and her respiratory rate is easy and she is not in any distress. And then I'm going to go ahead and just palpate on the front here, and we're going to go side to side. And then I'm also going to go ahead and percuss on the front side here too. And on the sides here. And one more. Okay, and then also going to auscultate. So I'm going to start above the clavicle here. And deep breath. And then working my way down, I'm going to hear bronchovesicular sounds. And then over the main stem of the bronchus, we're going to hear bronchial sounds. And then we're also going to hear vesicular sounds as we work our way down. And while we auscultate the lungs, we're going to use the diaphragm of the stethoscope for that. Okay, so then next what I'm going to do is just go ahead and inspect the carotid pulse. And we're checking for pulsation. So I'm just going to observe the carotids on each side of the neck, and then also the apex of the heart for pulsations. Then we're going to go ahead and palpate. So one at a time here, because if you do them at the same time, you could make the patient pass out. Okay, and then we're going to inspect this side. Okay, and then apical pulse here. Okay, and then we're going to do base and apex here. Okay, then I'm going to go ahead and listen. I'm going to auscultate with the bell of the stethoscope to the 4 areas here. So we have aortic, pulmonic, tricuspid, and mitral. And these 4, aortic, pulmonic, tricuspid, and mitral, we're going to assess in this sitting position, leaning forward position, and then left lateral position. So that one is checked in 3 different positions. And then also you're going to hear heart murmurs better with the diaphragm of the stethoscope. So that's when you would listen with the diaphragm. So that concludes our lung assessment and our heart assessment. And thank you.